Okay, good morning, everyone, and welcome. We are pleased to have with us today Lynn Ellenson. She's a volunteer for the Health Insurance Information Counseling and Assistance Program, and she's going to give us a primer on Medicare Basics. So Lynn, take it away.
Okay. Well, thank you, everybody. Thank you, Catherine. Yeah, I'm going to try and keep it to about an hour, well, less than an hour, so that there will be some time for questions. As Catherine said, I'm a volunteer for HIICAP, Health Insurance Information Counseling and Assistance Program. This is actually a federally funded program. It's found in many states. Every state has its own way of helping people to better understand Medicare. And in Suffolk County, HIICAP is administered by the New York State Office for the Aging through the Retired Senior Volunteer Program of Suffolk, RSVP Suffolk. So what we try and do is provide free and unbiased information about Medicare and Medicare-related insurance and financial assistance. Many people receive information from various private health insurance companies, but we try and tell you about all of them, and we try and make our presentations and the information that we give as unbiased as possible. And all of the information is given by people like myself. We're all volunteers. So what I'm going to try and do today is answer some key questions. Hopefully we'll get through all of them. What is Medicare and how does it work? How should I get Medicare? When and how do I enroll? What plans should I choose? Because there are a number of different health insurance plans that are connected to Medicare. And when can I choose my plans, but also when can I change my plans if it's not working out for me, if there's something else that's new for the year that might work out better. And you'll find out that Medicare has many costs. So how can I get help in paying for Medicare? And of course, we're not going to be able to cover everything. So where can I go for some more help? And then we'll have some time for questions. Okay, so starting with what is Medicare and how does it work? Medicare is a federal program, and it provides health insurance for people who are over the age of 65 and over, but also it actually works for people who are under 65 if they are receiving Social Security Disability Insurance, SSDI, for a certain amount of time. Usually that amount of time is 2 years. Also, those who are under 65 who have kidney failure and require dialysis or transplant can also be eligible for Medicare. So one of the reasons I think that Medicare can be a little bit complicated is because it has so many parts, and it has parts, it has plans. And so I want to try and take you through the parts of Medicare and the different plans that Medicare has. So many of you have heard of Part A and Part B. That's known as Original Medicare. Part A would be your hospital or inpatient visits or benefits, and Part B would be your doctors or outpatient benefits. So basically, Original Medicare was instituted back in 1965 with Lyndon Johnson, and it included Part A and Part B. Part D was added, a prescription drug benefit, in 2006. And there's also something called Part C, or Medicare Advantage plans. These are managed care type private plans. It's another way to get Medicare, consists of Part A, Part B, and usually a Part D or a drug plan. And all of this is through a private health insurance plan. And so basically, Medicare would be administered by private insurance companies, and these companies contract with the federal government to provide Medicare. Medicare Advantage or Part C is not a separate benefit. Everyone with Medicare Advantage still is considered to have Medicare, and Medicare Advantage plans are required to give you the same Medicare benefits as Original Medicare. So if you are signing up for Medicare for the first time, or you have received your Medicare card, you have to make some decisions. How should you get Medicare? And as I said, there are two different ways to do it: original Medicare or Medicare Advantage. So original Medicare, as I mentioned, consists of Part A, or hospitalization, and Part B, which is your outpatient care. Now, it does not include a drug plan. So if you are doing original Medicare, then you would decide if you want to add drug coverage. In a sense, it's optional to do that, but if you do not sign up for a drug plan at the time that you are eligible, then when you decide to sign up for a drug plan, then you are going to have a penalty, a financial penalty, which will get added on to the drug plan that you sign up for, and it will stay with you for life. So most people who sign up for original Medicare Part A and Part B also at the same time sign up for a standalone drug plan. Now, there are many co-payments and deductibles and different costs for Medicare. So a lot of people decide to get an additional supplemental coverage. You may know this as Medigap. It's basically Medicare supplement insurance. And I'll show you what that looks like in a little bit. But this is also optional. And you can buy that insurance in New York State just about any time of the year. Now, if you decide to go the Medicare Advantage way, then this would include Part A, Part B, and I say possibly Part D because sometimes people don't need a drug plan. They may have it with something else, so they don't need the drug plan. But most of the Medicare Advantage health insurance plans do have a drug plan included in it. So Medicare Advantage then would include Part A, Part B, a prescription drug plan. And then if you decide to do Medicare Advantage, then you would not be able to get a Medicare supplement. You can only get the supplement if you are doing original Medicare. So what are the differences between the two? Original Medicare is the traditional program started in 1965, administered directly by the federal government. Remember, it includes Part A and Part B. It's accepted by most doctors and hospitals in the United States, and you must get a separate drug plan. It's not included, and supplemental insurance is optional, but it can help you to pay some of your out-of-pocket costs, such as deductibles and co-insurance. Now, Medicare Advantage, remember, is that you are getting Medicare benefits through a private health plan. They must offer you the same benefits as original Medicare, but they can do it in different ways with different costs. There may be different deductibles, different co-pays, but basically you will be getting the same Medicare benefits. The biggest difference is that with Medicare Advantage, you're often limited to the doctors and the hospitals that are in the network of the particular plan that you choose. Whereas with original Medicare, on the left-hand side, you see that it can be accepted by most doctors and most hospitals in the United States. Usually with Medicare Advantage, you can get a drug plan from the same plan. And this is something that often is interested in, a lot of people are interested in, is that Medicare Advantage plans may also offer additional benefits, such as hearing, vision, dental, and there are a number of other ones as well. So what are some of the things you should ask yourself when you're considering Medicare Advantage versus original Medicare? First of all, you need to know what costs you should expect, the premiums, the deductibles, and the co-payments. There are co-payments for a lot of different things with these plans. Probably most important are my doctors and hospitals in the plan's network. Are there rules or restrictions I should be aware of when accessing the plan's benefits? For example, sometimes in some of the plans, in order to see a specialist, you have to be referred by a primary care physician. So you want to know what those rules are and whether you want to have a plan that requires you to do that. And then does the plan cover any services that original Medicare does not? So I already mentioned most of the plans cover dental, vision, and hearing, but what is actually covered, what kinds of dental, what kinds of vision, what kinds of hearing services are covered. And sometimes there are additional costs to these services, even though the plans say that they cover them, you still might be required to pay a certain amount for them. So you have to look at each individual plan to decide what all of its details are. Okay, so that brings us to what plans should I choose? So if you've signed up for Part A and Part B, or enrolled in Part A and Part B, you still have to make the decision of whether or not you are going to do original Medicare, and then look at the Part D plans, the drug plans, and the supplements, or if you are going the Medicare Advantage route, then you would want to look at what plans are available to you. So I'm sorry this is so small. Usually, I do these in person and I hand them out, but I kind of wanted you to see some of the information that we have on each of these plans. So these are the prescription drug plans, the standalone plans that you would be able to purchase or enroll in if you were going the Medicare, original Medicare route. And I should also mention the caveat that these are for 2021. We have not received the information on the 2022 drug plans. And so I'm just showing you this basically for illustration, so you can see the kinds of information you might want to think about. So these are the different companies on the left-hand side that have these standalone prescription drug plans. And each company has a few different kinds of plans at different costs, and they have different things about them. For example, the Aetna Medicare company has 3 drug plans. One of them has a monthly drug premium of $35, another is $76. And the third one is actually quite inexpensive at $7.30 a month for its premium. But then you see in the next column that they have annual drug deductibles. One of them has a deductible of $290. The middle one, Aetna Medicare Silver Script Plus, has no deductible. And the third one, Aetna Medicare Silver Script Smart X, has a deductible of $445. So although that's the cheapest, it has the highest deductible. See, do I have any on the next? Yeah, and I have a few on the next page as well. When the new drug plans come out for 2022, we will have available, HIICAP will have available this type of chart. And you can call us at our helpline and we'll be able to send it out to you. And it gives the phone numbers as well of the different companies. Now, I want to talk a little bit about Medicare costs, because I want you to see some of the costs that the Medicare supplements can cover. So first of all, for the Part A premium, most people who have worked 10 years or longer, or their spouses work 10 years or longer, will get Part A, Medicare Part A for free, because you've been paying into that fund your whole working life, basically. If you do not have a work history, or your spouse does not have a work history, then you could be paying up to $471 a month for a Part A premium. Now, with the Part A, the first 60 days in the hospital is free under Medicare, but there is a deductible for each benefit period. And a benefit period begins the day that you're admitted into the hospital as an inpatient, or into the skilled nursing facility. It works the same way. And the benefit period ends when you haven't gotten any inpatient hospital care for 60 days in a row. So it's possible that there will be more than one benefit period per year, which means more than one deductible of about $1,400. I mentioned that the first 60 days are free in the hospital. Days 61 to 90 are $371 a day, and days 91 plus are $742 a day. You only get 60 of those as lifetime reserve days. Skilled nursing facility, the first 20 days are free, but then you have to start paying $185.50 a day. You also will have to pay your Part B premium every month. That's $148.50 for most people, but if your income is higher, then you are going to have to pay a higher Part B premium. Now, also there's a Part B deductible. Now, what that means is that before your outpatient benefits, your Part B doctor's visits, for example, start kicking in, you will have to pay out of pocket $203 a year. It's a one-time payment. And then there's also 20% coinsurance, which means that Medicare pays 80%, but you would pay 20% out of pocket. This all sounds like quite a bit, but the reason I'm telling you is because I want to show you that a lot of these Medicare supplements will pay these kinds of out-of-pocket costs. Now, Part C premium, there's a premium for most Medicare Advantage Part C plans, so it's going to depend on the plan. And then Part D standalone drug plans also have a premium, and those vary as well. Okay. So let me just now talk about the supplemental insurance or Medigap. I mentioned it's optional, but it covers some or all of the co-pays, co-insurance, and deductibles in original Medicare. And the different plans, the different Medigap plans, they vary in what they cover. There are A plans, B plans, all the way to N plans. And the F and G plans will cover the most, and the A plans usually cover the least. And so let me just show you what that looks like. So in the first column are the different benefits that Medigap or supplemental insurance plans can give you. And you see across the top, A, B, C, all the way to N, those are the different levels of plans. So if we look at the F plan, for example, which is the most comprehensive, it has a diamond in every single cell, every single box, so that it gives the hospital co-insurance, the Part B co-insurance or co-payment, gives the first 3 pints of blood. It pays for hospice care, pays for skilled nursing facility care. It pays for the Part A deductible per benefit period, that $1,484, pays for something called Part B annual deductible, which is $203 this year, and I understand it's going up for next year. It pays for excess charge benefits, which means if your doctor pays more than what Medicare allows, and in New York State that can only be 5% more, then this Plan F will pay those excess charges. It pays for 80% of care outside of the United States, but there is no out-of-pocket limit. In fact, there's no out-of-pocket limit for all of these plans except the K and the L. Now, the F plan is the most comprehensive. Next to it, also the C plan. Those are not available to anybody who is new to Medicare as of January 1st, 2020. But if you were eligible for Medicare prior to that date, then you would be able to enroll in a C plan or an F plan. But if you are new to Medicare, the next most, I'd say, comprehensive plan is the G plan. And then also we tell people about the N plan, which basically has many of the benefits that the G plan has, a little bit cheaper. It doesn't pay for the Part B annual deductible of $203, but none of them do really, except the C and the F. And it doesn't pay for excess charge benefits, Part B excess charge benefits. But if your doctor is going by the requirements and what is approved by Medicare, then that shouldn't actually be of any interest to you anyway. So I just want to show you the different costs of these supplements. Again, this is 2021, and they're going to be changing probably. We may even get some new plans, some new companies, but right now this is what it is as of today. And you can see, let's just take the G plan. So look at the column that has G at the top. The cheapest G plan is from Empire Blue Cross Blue Shield. And that's $270.14. That same G plan costs $597.30 from Bankers Conseco. So one of the things we want to just warn you about is that the Bankers Conseco plan is really giving you the same thing that the very cheapest plans are giving you. So that you might want to consider the price when you're looking at which plan you should be getting. One other thing I want to mention is the high deductible. So the plan F, if you can enroll in that, or the plan G, they both have high deductible plans. And what that means is that after you have paid a deductible out of pocket, after you've spent out of pocket $2,370, and it might change in 2022, then you would be able to get all of the benefits that a person getting a G plan would have. And you can see that your monthly premium would be quite a bit cheaper. Only for the G plan, only 4 companies actually have that plan. And then there's also, as I said, an F plan as well. And the same 4 companies have the high deductible plan as well. Okay, so Medicare Advantage, I'll show you what those plans include. Again, they combine Part A, Part B, and Part D. And you are considered to be enrolled in Medicare, but your services are provided through a private health insurance plan. You also still have to keep paying your Part B premium every month. And there may be an additional premium for each of these Medicare Advantage plans. I mentioned before, some plans include benefits that Medicare does not provide, such as dental, vision, and hearing. And they're all going to vary, as you'll see in a second. The biggest difference from original Medicare is that you are limited to the doctors and the hospitals that are in the network of the particular plan that you choose. So again, sorry that these are so small. But I just wanted to show you the different plans that exist. We give you the phone number for each plan if you wanted to get additional information. And I guess, let's see, 1, 2, 3, 4, 5. The 6th column shows you what the different premiums are. Some have no monthly premiums. All of these, except for a few, do not. All of these have a drug plan included, and when they do have a drug plan, then we show you what the annual deductible is. And let's see, something else. They all, at the last column, they have hearing, dental, and vision. All of them have that. One other thing they have, the second to last column, is a maximum out-of-pocket amount. This is something that Medicare Advantage plans give you that original Medicare doesn't really give you. That is, after you've spent a certain amount of money out of pocket for Part A and Part B services, then you get everything for free. Basically, you don't have to pay anything. You're just completely covered. And the amount is different for these different plans. And of course, the lower the amount, as you can see, the second to last, WellCare, Today's, Options, Advantage Plus, 150A, the maximum out of pocket is $3,400. So once you've reached that amount, then the plan pays for everything. These are the same Medicare Advantage plans for 2021. I just wanted to show you some other things about the plan. Many of the plans have a copayment for seeing a primary care physician or a specialist. The first one, there's no copay for seeing a primary care physician, but if you see a specialist, it's $45 each time you see the specialist. And you can go down that column and see what the copays are. These are just for in-network. For some of them, if you go out of network, there's a different copay. And for some of them, if they're actually an HMO and you go out of network, then actually the health insurance company pays for nothing. So this is why it's very important to make sure that the doctors and the hospitals that you want to go to are going to be included in the particular network that you choose. The last column is your out-of-pocket costs if you were to go into the hospital. Now, if you remember, there's a pretty large deductible in original Medicare. If you go into the hospital, there's no such thing as a deductible with these Medicare Advantage plans, but in a sense they act like a deductible because the first several days in each of these usually will cost you some money. So for example, the first one, the first 5 days in the hospital, you would be paying out of pocket almost $400 per day. Then the day 6 through 90, if you're in the hospital, would cost you nothing. A couple of them, no matter how many days you're in the hospital, the cost would be a set amount. For example, the second one, $850 per stay. Down below Humana Gold Plus, it's $700 per stay. So there's no such thing as a deductible, and in the Medicare Advantage plans. Now, all of this seems like a lot of information, and it's a lot of information to juggle and to keep in your head and to really try and find out about. So Medicare has its website, www.medicare.gov. And I have to say, I have found this really useful in looking at plans and comparing plans. If you get into medicare.gov and then there's something that you would click that says find plans, and then you would come to this page and it says find a Medicare plan. And then it asks you to log in or create an account, but you don't have to do that. Just below it, you can continue without logging in. And then it will prompt you, will ask you what kind of plan you want to look at. You might want to look at a drug plan, a standalone drug plan. You might want to look at a Medicare Advantage plan. And so you tell, it asks you what your zip code is, whether you're getting any help financially from various programs. And then for the drug plan, for example, if you're looking for drug plans, then you would basically enter the drugs that you're taking, and it will tell you which plans cover those drugs and what the cost would be over the next year. Now, right now, the new plans have not gone into this website, so it's still only giving you 2021 information. But I'm guessing that in a couple of weeks, it's going to be updated for the 2022. It has to be, because people will be able to change their plans, and they're going to have to see what the new plans are for 2022. Okay, so let's go back now, and how do you enroll, and when can you enroll? So there are 4 ways to enroll in Medicare. The first is automatic. The second is something called an initial enrollment period, around the time when you're 65 years old. There are special enrollment periods, and there are a number of reasons for special enrollment periods. And then there's a general enrollment period. Now, you will be automatically enrolled if you are 65 and you're receiving Social Security retirement benefits or railroad retirement benefits at the time that you're approaching 65. You'll get a card in the mail and you'll be enrolled in Part A and Part B. If you are receiving Social Security disability insurance for 24 months or railroad disability annuity checks, then you will also be automatically enrolled in Part A and Part B. And if you've been diagnosed with ALS or Lou Gehrig's disease, you're going to be automatically enrolled in Medicare the first month, not the 24th month, but the first month that you receive SSDI. Now, when you're automatically enrolled, you're going to get a card and you're going to be enrolled in Part A and Part B, but you are given the option to turn down Part B. Remember, Part B has a monthly premium. So if you don't need it, because let's say you or your spouse is continuing to work and you have your health insurance through work, then you can turn down Part B. But be really careful. Don't turn down Part B unless you have employer insurance from you or your spouse's current job, because if you turn it down when you should have signed up, then you are going to be getting a premium penalty down the road. So, but if you are working, if your spouse is working, then you can turn down Part B. Now, the initial enrollment period is around the time when you're turning 65. Let's say you haven't been automatically enrolled because you are not getting Social Security yet. This is a 7-month period. It includes the 3 months before your birth month, and the 3 months following your 65th birthday. And coverage is going to start depending on when in this initial enrollment period that you enroll. So if you enroll before your birth month, let's say your birthday is in September, if you enroll in August or July, then your coverage for Medicare Parts A and Part B are going to start on day 1 of your birth month, September 1. If you enroll after your birth month, then there's going to be a delay in coverage. It's going to be either a 1 or 2 month delay. So we always encourage everybody to enroll before their birthday, before their birth month, so that day 1 of their birth month, then their benefits will start. Now, the other enrollment periods I talked about, special enrollment periods and general enrollment period. Special enrollment periods are periods of time outside of the normal enrollment periods, and these are triggered by specific circumstances. One of the ones that's most common is if you retire from your job and now you're no longer getting health insurance from your employer, then you will get a special enrollment period. And that special enrollment period will last 8 months. So you have 8 months to apply for Medicare. There are some other examples. If you move, you'll have a special enrollment period to change your various plans, because your Medicare Advantage plan, the networks may be different where you're moving. Or if your plan no longer offers certain coverage or terminates a significant amount of network providers, then you would have a special enrollment period. And there are actually a whole host of reasons why you might get a special enrollment period. Now, there's also a general enrollment period when you can enroll for Medicare. That's January 1st through March 31st. If you've missed some of these others. You can sign up for Part B with coverage beginning in July. So there is a gap in coverage. If you use your general enrollment period to sign up for the first time for Medicare, then you're probably going to be incurring a late enrollment penalty. Now, when can you enroll in a drug plan? you can enroll in a drug plan. First, you have to enroll in Part A and Part B, but you can enroll in a drug plan during your initial enrollment period, IEP, or around the time when you're turning 65. You can also enroll or make changes to Part D coverage during the fall open enrollment period, which is coming up now, October 15th to December 7th. Okay, if you do enroll in a drug plan for the first time during the fall open enrollment period, you may end up paying a premium penalty for Part D because there's been a gap in when you were first eligible to enroll in a Part D drug plan. And when can you enroll in Medicare Advantage? You can do that during your initial enrollment period. Or if you qualify for a special enrollment period, for example, if you retire from your job or you lose your creditable health coverage. For Part C or Medicare Advantage, you must have Parts A and Part B to enroll. Now, enrolling in Medicare supplements, in New York State, you can enroll at any time. Companies can't deny you coverage or charge you more because of your health status. And also in New York State, people with Medicare who are under the age of 65, for example, people with disabilities, have the same rights to buy a Medigap plan as people who are age 65 and older. You can find all the different plans again on the Medicare.gov site. It will tell you, what plans exist and in what supplemental plans exist in your particular area. And you can then decide which plan you want, and then you would call the plan. You'd call their phone number is given on our sheets, and enroll that way. And we'll also help you. The HIICAP counselors can help you go through these different supplemental plans because it can get quite confusing. Just to remind you, because I've been talking about the different penalties, there's a Part B late enrollment penalty if you don't enroll in Part B when you should have or when you were eligible to. That is 10% of your monthly Part B premium, and it changes every year, times the number of full years that you were without Part B. There's also a Part D late enrollment penalty, and that's 1% of whatever the national base beneficiary premium is. So it's almost like a sort of an average Part D premium. This year it was $33.06. So for every month that you delayed enrollment, you would pay 1% of the national base beneficiary premium. And I spoke to a woman the other day who basically hadn't enrolled for 12 years. And so her premium ended up being about $51 per month added on to her Part D drug plan. So, it can actually end up being quite a bit of money. The other thing I just wanted to mention is not a penalty, but people whose income is higher than $88,000 as a single person or $176,000 as a couple will have to pay higher Part B and higher Part D premiums than other people whose income is below those amounts. Okay, now sometimes you might be unhappy with your plans or new plans are coming out, which is the case in fall open enrollment. So this is the main time when you can change your plans. Fall open enrollment is October 15th to December 7th. You can change, if you have original Medicare, you can change to Medicare Advantage. If you have Medicare Advantage, you can change to original Medicare. If you have Medicare Advantage and you want to change your plan, open enrollment is when you can do it. Or if you have a standalone prescription drug plan, and you want to change to a different plan, let's say you've gone on a particular drug that is not covered by your current drug plan, then open enrollment is the time to do it. Now, we tell everybody, even if you've been happy with your plans, you still should review your coverage, your Part D coverage, your Medicare Advantage plan coverage, basically just to see what's out for the new year, to see whether something else might be better for you and actually might be less expensive. Now, the Medicare Rights Center, which is sort of the technical assistance that I often get, they suggest that when you're making changes to your health or your drug coverage during fall open enrollment, that you actually call Medicare, and the number is 1-800-Medicare, and tell them what your changes are. Even though certain things are supposed to be happening automatically when you make your changes, you just want to make sure that Medicare has a record of it. So that's the advice that they're giving, and I'm just passing it on to you. You should also, I think, use the Medicare Plan Finder that I talked about before, www.medicare.gov, and find a Medicare plan. And again, the 2002 plans are not in there yet, but I would say in a week or two, you should check and see whether they are. One of the things about open enrollment, and you may find this yourselves, that you're getting a lot of calls, you're getting a lot of mail, and this is really a good time for scams. And so we try to warn people that during fall open enrollment, almost any time, but especially now, watch out for marketing violations and enrollment fraud, especially during fall open enrollment. You should watch out for people who pressure you to join their plan, who tell you that they represent Medicare and they want to offer you a free service. Medicare doesn't do that. So you should just make sure that you basically don't want to be pressured by anybody. You should watch out for people who call you or visit your house without your permission, or who offer free consultations only to people with Medicare, and then they ask you for your Medicare number. This is a really common scam, and be really careful, especially this time of year. Or they inform you that you're going to lose your Medicare benefits unless you sign up for a certain plan. So be very careful, because that's not going to ever happen. Okay, so I talked about fall open enrollment. There's something called Medicare Advantage open enrollment period from January 1st to March 31st. This is where you can change your Medicare Advantage plans. You can leave Medicare Advantage and you can switch to original Medicare with or without a Part D. You cannot switch from original Medicare to Medicare Advantage, and you can't make any changes to your Part D standalone plan, but you can change your Medicare Advantage plan to switch to original Medicare. Now, also, if you're new to Medicare, you have something called a SEP 65. And what that means is that a person approaching age 65 enrolls in Medicare, in a Medicare Advantage plan with a drug plan during initial enrollment period. Remember, that's the 7-month period that surrounds your birthday. Well, if you have done that, you actually have 12 months to change from Medicare Advantage to original Medicare. And while you're doing that, you also are allowed to enroll in a standalone Part D plan at the same time. You also will be able to buy a Medigap plan, because you can do that at any time in New York State. So your SEP 65 basically allows you to, I would say, get out of Medicare Advantage and join original Medicare if the Medicare Advantage plan was not something that you thought that it might be. So you have the whole year basically to do that. All right, how can I get help paying for Medicare? I'm not going to go into the details of these, but there are many materials that talk about these programs. I'll just tell you a little bit about each one. So there's some, and you notice that there are a lot of costs in Medicare. So there's something called Medicare Savings Programs, or MSPs, and they would help you to pay Medicare premiums, Medicare co-pays, and co-insurance. There are 4 different Medicare savings programs, and there are eligibility requirements for all of them based on income. Luckily, in New York State, only your income is looked at and not your assets. These programs are actually Medicaid programs, but they help you with your Medicare costs. Now, there's a Social Security program called Extra Help. This is something that subsidizes your drug costs, and that's done through Social Security. If you actually are eligible and receive benefits through the Medicare Savings Program, then you are automatically going to get the extra help for your drug costs. There's also something called EPIC in New York State. This helps with your drug costs and gives you 1 special enrollment period a year. And that's actually really useful because you could be on a particular drug plan and you start taking a particular drug, and that drug is not covered in your drug plan. And so you need to switch to a different drug plan. Typically, you can only change your drug plan during fall open enrollment, but let's say it's July or even February. So you're going to have to wait until October. But with if you have EPIC in New York State, then you would be able to get a special enrollment period to change your drug plan. EPIC, unfortunately, is only for people age 65 and over. So if you have Medicare because of a disability and you're younger than 65, then you're not really eligible for EPIC. And then, of course, Medicaid is another program that covers many of the things that Medicare does not cover, and also that does cover. And that is dependent upon your income and also looks at your assets. So I'm not going to go through all of these programs, but what I will say is that if you are interested in learning more about them, because they can actually be a whole separate webinar, I think, then you can call our helpline and HIICAP helpline and ask them to send you materials on these specific programs. And so this, I think, is something that if you have your telephone camera available, you might want to take a picture of this screen, because I think this one will be quite useful for you. And this is a number of the different places that you can go to or call to get additional information. First, the HIICAP helpline. You can call to if you have specific questions. People will try and answer your questions, or also tell you where our different counselors are in what libraries at what time of the month. Or you can ask them to send out specific materials. I suggest that in a week or two, if you're interested in getting the materials on the different plans that I showed you, you should call the helpline and ask them to send them out to you. Medicare's telephone number is here, and you can sign up for Medicare by calling this number, or ask your questions. And then there's also a Medicare website that I talked about, but it really has a good searching function. So I think that's a very useful website. Social Security is where you sign up for Medicare, actually. So this is their phone number and their website. And then there's a Social Security field office that's probably near you. And you would usually be able to go there in person to sign up for Medicare or have other things calculated for you. I don't think they're open yet in person because of COVID, but there's a locator that you could go onto online, click on it, put in your zip code, and we'll tell you the closest Social Security field office and the telephone number, so you'd be able to call them with questions as well. It's mainly for signing up for Medicare. Let's see, Medicaid assistance. the Nassau Suffolk Hospital Council, if you're interested in finding more out about Medicaid or need assistance in signing up, you can have one-on-one counseling in the same way that we do counseling one-on-one for Medicare, they do it for Medicaid. And they typically were doing it in person, but I don't think they're doing it in person yet. So you can call this number and arrange to speak to a counselor about Medicaid. The Medicare Rights Center is something that I go to for advice and information frequently, but there's a number for the public, which if you have specific questions, and especially if you need help in very detailed kinds of things like appealing for certain things, you can call the Medicare Rights Center and they're very good. And they have a website, Medicare Interactive, where you can key in your questions and some answers will come up. And then finally, I talked about fraud. There's fraud that you can report through Medicare, but there's also something called the Senior Medicare Patrol that if you find that you're being, it's something that is sponsored by the Administration for Community Living, which I think is part of Health and Human Services. And you can call them or go onto their website and you can report various what may seem like fraud to you if you're getting contacted by people in the ways that I was explaining before. Okay, so I think I'll stop now for questions. And I'm sorry I didn't leave us too much time. We can take a few.
Yeah, feel free to unmute yourself or you could type it in the chat.
Did I mute myself? Where am I here? Okay. I stopped the sharing, but am I still there?
Yeah, we're all still here. Does anyone have any questions? As I said, you can unmute yourself or you can type it in the chat and we'll keep an eye on that.
I have a question.
Okay, go ahead.
Okay. Do you enroll in Part D for the drugs on the original Medicare, or do you have an option in the Medigap and then you'll get a penalty from the original Medicare?
So if you're deciding to go the original Medicare route, then you would want to look at the standalone Part D plans. And the Medigap is actually something totally different. And so that helps you with your co-pays and your deductibles for Part A and Part B, but not for Part D.
Okay, okay, I get that. Thank you.
Okay.
Does anyone else? Oh, go ahead, Tina.
Can you explain the difference between the Medicare Advantage and Medigap?
Okay, so Medigap, another name for it is supplemental Medicare insurance. And Medigap actually fills in the gaps of the different costs that you might have. You can get a Medigap if you are doing original Medicare. So with original Medicare, it doesn't have a Part D drug plan included. So you would get a standalone drug plan and optionally you would get a Medigap plan. Now, what did you say the difference between that and Medicare Advantage?
Right.
Yeah, so Medicare Advantage is just another way to get Medicare benefits, but you do it through a private health insurance company. So instead of dealing with the federal government and Medicare, the Center for Medicare and Medicaid and Medicare, you would deal with this private drug company. Private health insurance company. They basically contract with Medicare, and Medicare says, for every person you have signed up, we'll give you a certain amount of money, but you have to give them Medicare benefits. And so you're dealing with that company. And most of them will include a Part D drug plan. And so you don't have to sign up for a separate drug plan because it's going to be included in the plan. even so, you need to make sure if you're choosing a particular Medicare Advantage plan and it has a particular drug plan, you still want to make sure that the drugs that you are taking are covered in that plan. So every plan is going to be a little bit different. So you really have to, I think, go online, look at the different details of those plans and what it's actually giving you.
Okay.
Does that answer your question?
Yeah, so you're saying that Medigap is a federal program.
No, it's private.
Oh, it's also private.
It's private, actually. These
Okay.
are private health companies, health insurance companies, but they work with Original Medicare.
Medigap, okay.
Medicare, yeah.
Okay, and I know this is a very broad question, but do you like see in general, like for the average income person, like a better way to go as far as Medigap, Medicare Advantage?
Well, what I say about Medicare Advantage, for example, upfront, your costs are going to be less because if you do Original Medicare, you're not only paying for your Part B premium, which everybody has to do, but you're going to be getting a separate premium for your Part D drug plan. And you probably are going to want to get a supplement, and those are pretty expensive. I don't know if you could see them, on the screen, but they can be quite expensive per month. Whereas the Medicare Advantage only has a one-time, like a much smaller monthly premium. But the thing is, I tell people also, you may have some hidden costs there. It's just that they're unknown costs. It might be that you have to go to a specialist that's outside of the network. And so then your costs are going to be really high, but you won't know what those costs are until, you get sick, and then you're going to be landed with those costs. So I think that the Original Medicare is maybe more, you're taking fewer risks in a sense, but it's going to cost you for that. There are ways to reduce your costs, I think, on the supplement plan that you choose. But it's still going to be a lot more costly upfront than your Medicare Advantage.
Okay.
Helps you, but
Yeah. Thank you. It does.
anything else?
Yes, Lynn is going to show up on.
Can I ask a question? On this, you got me confused with this Part D and the penalty, and then being able to go in and out of an Advantage plan and cancel. Do you recommend always, in other words, if you're on the Advantage plan, you're not with Medicare A, B, or D?
No,
No, if you get an Advantage plan,
he is totally separate.
you always have to pay your monthly premium, your Part B premium. Everybody does that.
Okay, so do you recommend always doing Part D, as in David, with the Medicare plan, so that you're not penalized in the long run down the line?
Well, for the most part, yes, but some people get Part D in other ways. So if you were in the military, there's a drug service in the military. So if you get your drugs that way, you would not have to have a Part D.
Do you get penalized?
No, you would not get penalized. As long as you have creditable drug insurance, then you would not get penalized.
So you can have credible drug insurance from the Advantage plan and not get penalized?
They're two separate things.
So the Advantage plan, most of those plans include a Part D drug plan.
Right.
That don't include a Part D drug plan are for people who are getting their Part D drug plan a different way. So everybody has to have some sort of drug plan or else they'll get penalized, but it doesn't have to be through the Medicare Advantage.
Okay.
If you have something else, for example, the drug plan through the military, that would act as creditable drug insurance. And so that would be okay not to get the drug plan included in Medicare Advantage.
I have different question.
Okay.
If you take the Advantage plan at the original enrollment and then you renounce it, can you ever get back in?
Yes, you, fall open enrollment, you can.
So you, pretty much every open enrollment, you can switch back and forth depending on
That's
what
right.
works for you that year.
That's exactly right. Yeah.
Thank you.
And don't remember, don't forget, it doesn't start till 2002 also. So if you sign up in October, the plan that you sign up for in October is not going to start until January 1 of 20.
Fair enough.
And one
Okay.
more question about the Part D as in David. If I sign up for Advantage plan and I refuse their D, and can I get it from my original Medicare?
They're separate.
No.
Okay.
And I mean, I don't think you'd want to. I think the advantage of Medicare Advantage is that it's kind of one-stop shopping.
Okay. And the penalty would not apply if I decide to change that and cancel the Advantage and go with a Medigap
No,
and
because
then
you
the
had it.
original Medicare?
If you decide to change to original Medicare when you can,
Yes.
then, I mean, the important thing is not to have any gap in service. So
Okay.
if you had a Part D in your Medicare Advantage and you're going to switch to original Medicare, make sure that you also sign up for a standalone Part D plan.
Okay. And no penalty, right?
Then you wouldn't have a penalty.
Okay.
Is there any way we'll be able to figure out when this lecture shows up on YouTube?
I'll probably be posting it by the end of the week, either today or tomorrow. So you could watch it again, or you could refer friends and neighbors.
And how should we search for it?
You go to SHPL SHPL tube, in the Google, it should be your first result.
Thank you.
All right, well, thanks, Lynn, so much for making a very complicated subject a little clearer.
Little.
We appreciate your expertise and thank you all for joining us this morning.
Thank you.
Okay. Bye, everyone. Have a good day.
You too.
Bye.
Bye.